lymph nodes, and that is all till here. Oh. Lymphatic system starts from lymphatic capillaries. And main differences, lymphatic capillary from blood capillary, they are blind. Lymphatic capillary, blind. Blood capillaries, they opens in both sides. And lymphatic capillary, wider, usually wider than blood capillaries. Consist of endothelial cells, and heat is in lymphatic capillaries, there is no basal membrane. In blood capillaries we have basal membrane and endothelial cells. Heat is basal membrane is absent. From lymphatic capillaries, lymph flow into postcapillary, and border between lymphatic capillary and postcapillary, that is first valve. In postcapillary we have valves, and wall of lymphatic postcapillary has basal membrane. Postcapillary continues into lymphatic vessel, and differences between lymphatic postcapillary and lymphatic vessel, that is presence in vessel, we have 3 layers in wall, like in blood vessels. Which layers? External, that is adventitia, middle layer tunica media, and tunica intima. The same 3 layers like in blood vessels, but lymphatic vessels, wall of lymphatic vessels thinner than blood vessels. You know, the thickest wall in arteries, thinner in veins, and thinnest in lymphatic vessel. And lymphatic vessels, the same like veins, they have valves, and they interrupt with lymph nodes. That is first lymph node on the way of lymph from inner organ or from part of the human body. First lymph node has name regional lymph node. From lymph nodes, another lymphatic vessel continues, and also some usually also interrupts with lymph nodes. Then another vessel, the same maybe third lymph node, and after that large vessels, large lymphatic vessels, which not interrupts with lymph nodes, has name lymphatic trunks. 4 constant trunks in human body and 1 unconstant. It is truncus lumbalis, right and left lumbar trunks, join together and forms ductus thoracicus, thoracic duct. And thoracic duct pass through diaphragm together with aorta, through hiatus aorticus, goes upward, and thoracic duct opens into left venous angle. What is it? Venous angle? That is a junction between what and what? Subclavian vein and internal jugular vein. That is beginning of brachiocephalic vein. And thoracic duct, ductus thoracicus, opens into the left venous angle, and right venous angle receive ductus lymphaticus dexter, right lymphatic duct. Only 2 ducts in human body, ductus thoracicus and ductus lymphaticus dexter. Thoracic duct forms with the help of two lumbar trunks. The same thoracic duct receive lymph from truncus broncha mediastinalis sinister, truncus subclavius sinister, and truncus jugularis sinister. These 3 trunks on on the left side opens into thoracic duct, and the same 3 trunks on the right side right jugular, right subclavian, and right bronchomediastinal trunks. They join together and forms ductus lymphaticus dexter, and right lymphatic duct opens into the right venous angle. Sometimes right lymphatic duct is absent. In this case, these three trunks directly opens into right venous angle. That is why main lymphatic duct in human body, that is thoracic duct, it receives lymph from lower extremity, from true pelvis, from abdominal cavity, and from left side of thoracic cage, left upper extremity, and left side of the head and neck. And only from right side of the head, neck, right upper extremity, and right part of thoracic cage, lymph goes to right lymphatic duct and right venous angle. Some organs have not got lymphatic capillaries. For example, in brain and in meninges of brain, there is no. In pituitary gland, in eyeball, for example, in cornea, in lens, in spleen, parenchyma of spleen, there is no lymphatic capillaries. What else? In bone marrow, yes. In cartilages, in teeth, in epithelium of skin and epithelium of mucous membrane, and in lobule of liver. In lobule, lymphatic capillaries are absent. In interlobular space, they are present, but inside of lobule of liver, lymphatic capillaries are absent. In glomerulus of kidney, the same. There is no lymphatic capillary. Some words about lymph node. Lymph node has capsule, and below of capsule, between capsule and cortical tissue of lymph node, we have space. That is sinus marginalis, marginal sinus, or subcapsular sinus. From here, and afferent lymphatic vessels comes to convex part of lymph node. They bring lymph to lymph node. And here it is hilum or porta of lymph node. Here it is, we have afferent lymphatic vessel which moves a lymph from lymph node into a lymphatic vessel, and near of hilum of lymph node we have portal sinus, subcapsular sinus or marginal sinus. Here it is sinus in portal sinus, and another sinuses we have in cortex, sinus corticalis, and in medullary part of lymph node, sinus medullaris. Sinus medullaris. In cortex of lymph node we have lymphoid tissue, that is place of proliferation of lymphocytes, and lymphocytes goes into the lymph and leaves lymph nodes through afferent vessels. The same in porta of lymph node we have blood vessels, artery come to lymph node, and vein remove blood from lymph node. Classification of lymph nodes, there are superficial and deep lymph nodes, parietal and visceral. What else? We speak about different shape of lymph node. Some of them has round shape, sometimes they may have elongated shape. In different parts of human body we have different shape of lymph node, and usually size of lymph node not larger than 5 millimeters. If lymph node larger than 5 millimeters, that is abnormal size, necessary to Maybe it is inflammation, maybe you know that some cancer cells pass with lymphatic vessels and stay accumulates in lymph nodes and grows heat. Is in this case lymph nodes the same, enlarge in size. What is the main function of lymphatic system? Drainage of tissues. It remove interstitial fluid from tissues. 90% of fluid removes with blood vessels, and 10% of fluid removes with the help of lymphatic system. That is first function. Another functions are protection from infection, that is immunological function, transport of what? Of fats. I think you know that fats absorbed in intestine into lymphatic capillary, not in blood, in lymphatic capillaries, and lymphatic vessels and lymph transport fat from place of absorption into general systemic circulation. Well, that is all general information about lymphatic system. Next time, not necessary to draw, that is only for understanding. I explain 4 main trunks: lumbar, bronchomediastinal, subclavian, and jugular, and one unconstant trunk, that is intestinal trunk, truncus intestinalis. In 25% of cases only is present. If it is absent, lymphatic vessels from intestine opens usually into lumbar trunk, truncus lumbalis, and then continues with thoracic duct into left venous ankle. Well, today that is all.